Today we are interviewing Mr. Mohamed Al Mheiri from Dubai Health Authority. And the focus of our discussion is understanding the various strategies Dubai Health Authority is initiating to position Dubai as a medical tourism hub. Welcome, Mr. Mheiri, and it's a pleasure talking to you.
My pleasure as well.
Give us a little bit brief about your initiatives and what is your role at the Dubai Health Authority.
So starting with myself, I'm the director of the Health Tourism Department at Dubai Health Authority. The department has been initiated by the Crown Prince Sheikh Hamdan in 2016 to focus on the niche market of medical and wellness tourism, being able to position Dubai as the overall city that provides you everything that you want, whether it's from family, it's from business, it's from health. Dubai is the place to be. So this is our vision to the destination, and we would like to welcome everyone coming to it.
So how is Dubai Health Authority building up the infrastructure to enhance the needs of the international patients?
So looking at how we are actually transforming the destination, being a leading healthcare destination, is through stringent rules and regulation, ensuring that there is a criteria, there is a policy that is followed by the healthcare facilities, ensuring quality service to our patients. Now, with that in mind, accreditations plays a big role.
Absolutely, yes.
In, for example, the type of treatment that is provided, how is it provided, what is the process of it. A few years ago, we have been ranked the first as the UAE in general, a destination that has one of its hospitals internationally accredited by GCI. And it is part of our process. So let's assume you are an investor that wants to come and open a hospital in Dubai. So upon opening, part of our requirements as a government authority to ensure that we are providing quality services, we make you go through that accreditation journey to ensure the service is on par of what we are expecting as a government and as we are expecting as an individual as well.
That's really interesting. So what you're saying is that Dubai Health Authority is supporting the new entities, getting them all the accreditations which are required to meet the standards of the international patient.
If I just elaborate on that, we put it as a policy. Now the following part would be taken by the healthcare facility through any accreditation body that has been approved by Dubai Health Authority.
Okay.
But not necessarily promoting it. We enforce it on the healthcare facilities
to have those basic accreditations which is like required as part of the patient journey.
And I think like if you look at how Dubai is developing, you can see the FDI perspective of it, where investments are coming in within the healthcare industry.
Yes.
Where we have reached today 5,161 healthcare facilities.
Okay. That's really interesting,
We have more than 60,000 healthcare professionals compared to last year. And today, healthcare professionals is a scarcity. You cannot find it elsewhere.
I agree.
And we can see those numbers are increasing.
Absolutely. There are a lot of companies, who are really struggling for professional healthcare, manpower and all. Is there any specific speciality you are targeting when you're positioning Dubai as a medical tourism hub?
We are more focused on both the medical and the wellness aspect. We can see that the major part of our promotion comes to the elective part, covering dermatology, dental, cosmetics, orthopedics, wellness, ophthalmology, fertility, OP and gynae. Those are the major services or specialities that we focus on promoting.
Focusing for the medical tourism.
So I think whenever you think about different specialities, I think that there is an aspect of the talent that you have. And it would be more or less, as we mentioned, it is a scarcity even when we talk about nursing, for example.
It is indeed.
People are looking, or countries are looking for healthcare professionals, correct?
Yes.
So I think that there are certain complicated specialties, such as urology, for example, in which the actual diagnosis is quite difficult. The consultation is difficult. It is not only about the technology, it is the understanding of the profession, the talent that you have attracted to provide you that service. But even that doctor is sarcastic.
Yeah.
So I believe whenever it comes to the elective part of treatments that we are trying to market Dubai through, knowingly that we have 54 hospitals with all of the specialties available within their hospital.
When you're talking about speciality and when you're talking about like these special treatments and all, are you also reaching out to international partners and as well as the medical insurance companies for patients to facilitate their
So looking at
patient journey?
looking at, for example, the insurance companies that are currently sending their patients outside
Yes.
because they cannot service them or provide them the treatment within the country of residence. Like if you know insurance, if you buy a package from any insurance company, it would only cover you within the country of residence.
Yes.
There are premium insurances that would cover everything. Right? In that sense, I believe that a part of our job is to promote what Dubai has to offer.
Yes.
But it is part of the job of the healthcare facility when it comes to the transactional part. Because the insurance is more focused on price-based treatment with the quality, of course. Like
Yes.
the insurance will have a set of criteria for the healthcare facility that they will select, but that service needed to be provided on a certain price. Because the insurance business model is hopefully he gets the health insurance without getting sick. That's how they get rich.
That's how they get rich.
I don't mind paying that as long as I am healthy.
Exactly.
But by the time the actual problem comes in, right, the insurance company's model they require someone or a healthcare facility that promotes that service, so it will be quality and price-based. Now, when it comes to the commercial part of it, or the business agreement that you have with the board, the insurance company and the healthcare facility, we are here to tell you that we have such facilities available. Promoting to them what are the services that we have. But it is the job of the healthcare facility to approach those international insurance companies to tell them we can be on par with X country that is providing you X treatment for X amount. Each and every hospital would have inpatient and outpatient. Certain specialties would be overperforming. You will have a waiting list. You will have other specialties maybe have a moderate pace of patients, right? Now, to me, as an investor owning a hospital, I would like each and every specialty to be top performing. How can I do that? From the hospital management point of view, they need to find solutions. And
they need to collaborate more, probably, as you're rightly saying that. Yes.
Right? So capacity plays a big role. If they are currently serving the residents and the community that we have, and they are overly booked, they cannot cater to
the more patients.
Exactly. There might be a huge waiting list for X doctor or X.
When you are looking at it today, when we talk about medical tourism, there are a lot of companies who are positioning themselves as a medical tourism hub and all. So what different marketing initiatives are you taking to differentiate Dubai from a medical tourism hub vis-a-vis other countries?
That's quite a complicated question in a sense of differentiate. Knowingly that at the end of the day, being able to provide quality healthcare service with the outcome that is wanted, right? Like every patient that is sick is looking for a cure. Inactive, on the other hand, might be looking for something that is more aesthetic. So me as an individual living in Dubai, if I am sick, I would like to get better.
Yes.
Right? Now, being able to put that as part of our objective, or the main objective is for the person or the patient to come experience what Dubai has to offer. Overall, with providing you the quality care and the outcome that you are wanting in a sense.
No, but what marketing initiatives are you doing? Like collaborate?
We have few collaborations. We have collaborated with Visa. To come up with certain packages to Visa that card.
The Visa card holders, yes.
So we have worked with them to create packages.
Some certain packages where patients
Kuwaiti citizens. That has a Visa card. Maybe 1 year ago or 2 years ago. While doing that initiative with Visa, they had a certain number of percentage of discount through the healthcare facilities
Yes.
through that part.
And just my last question, which is very, very important, which is always on our head. And when we talk about the regulatory framework, which is very crucial for a patient treatment and all. So what kind of regulatory framework is in place to ensure the safety as well as the rights of the international patients?
I believe that the patient charter is already available per se. It is quite easy for any individual to raise a complaint, to file a complaint, and our response time is quite phenomenal, I believe.
Okay.
But throughout complaints, there are committees that are formed. Maybe there is some sort of, I'd say, wrongdoing within an operation that is investigated, and the patient right is covered in that sense. And whenever it comes to the regulatory aspect of things, I believe I'm not a healthcare professional per se, but working in DHA, I have realized three things. We are focused on more or less the processes, the quality, through the policies that we enforce on healthcare visitors. That will help us ensure that the outcome is what we want, in addition to covering all of the requirements in an OP theater, for example.
Okay.
I'll give you simple thing. So let's assume there is a patient that needs to go to the emergency.
Yes.
There are certain criteria and rules that Dubai Health Authority is following with the healthcare facilities that are providing such a service of having an emergency unit where the access needs to be quick.
Yes.
All right?
Yeah.
Looking at this model per se and putting it across the whole healthcare facility is what we're trying to achieve. Now, this is only one angle that, because I am not
From the framework or
from the professional side,
Okay.
nor from the investor side, where I understand what does DHA require. Like certain areas require certain space, requires certain amenities to be within the actual room.
Absolutely.
Certain
Yes.
guidelines for you to follow. I believe that the way that we are sharing that knowledge with the healthcare facility is quite phenomenal, and I think each and every healthcare facility wants to develop
What it has to be.
and we only do that putting in mind that we are more focused on the patient. Our end result
Is the
yes, it is a patient-centric approach.
Yes, that's really wonderful. And thanks a lot for talking to us. Is there any message which you would like to give to our readers?
Follow us, visit Dubai Health Experience website, and hopefully you get to know more of what Dubai has to offer in terms of health and medical tourism.
Thank you. Thanks a lot, Marcus.